So for today's series of videos, we're going to be talking about manual therapy, in essence, mobilization of the wrist and hand. We're going to begin with a discussion of our distal radial ulnar joint. And to begin with, let's start in a palm down position or a pronated position of the forearm, wrist, and hand. There's a couple landmarks that we can identify from an anatomical standpoint that will help us in terms of understanding what's going to be stabilized and what's going to be mobilized. First, we can see a little bit of a bump or protrusion here on the ulnar aspect of the wrist and hand. This is the ulnar styloid process. If we come down on the radial side, there's a bump that kind of comes down to right about here. We feel that go in. So here's our ulnar styloid process. Here's our radial styloid process. What you will note is they are not even. The radius extends a bit further, which is one of the reasons why when we look at total amount of radial deviation versus total amount of ulnar deviation, it's about a 2-to-1 ratio, favoring more range of motion and mobility to our ulnar side. So when we're looking at the radial ulnar joint, recognize that when someone is lacking in either a pronated position or a supinated position, this is often the joint that we want to focus on. And this is common after someone has sustained a distal radial fracture, such as a Smith or a Colles fracture, or after someone has been in a cast due to closed reduction. So let's get started by first stabilizing here on the ulnar aspect of the wrist and hand. We're going to place our thenar eminence right over top of that ulnar styloid process. We're then going to come to the radial aspect. We're going to orient our force from what we would call the dorsal aspect towards the volar aspect. We can also think of this in terms of posterior and anterior. And so the force is going to be going towards the pillow at a slight angle so that we are mindful of the position of the joint. Again, dorsal to volar at the radial ulnar joint. This would assist with someone who's lacking that end range pronation. We then can adopt a palm up position. Again, we want to stabilize our ulnar aspects. We're going to switch our hands. We're then going to come to our radial side, take our thenar eminence there. We're stabilizing here, mobilizing here. Note the line of force is going to change now to assist with supination now. So this would be for your patient or client who is having a difficult time opening the palm of the hand up into a more supinated position. Again, volar directed force, dorsal directed force, assisting with pronation and supination at the radial ulnar joint. Have a go with a peer or colleague and let me know if there's any questions.